Soft One has been developed and made in Norway. Soft One products are available in two widths, 3 and 6 cm wide, and in different lengths. This product contains latex. General facts about Soft One wound bandage. It is self-adhesive, will not stick to the skin or body hair. It contains latex but does not contain any glue substances. It can also be used when the skin is wet or when topical ointments or creams have been applied. It is skin-friendly, stretchable and compliant. It does not prevent joint movement. It is breathable. It adheres to itself even when wet. It absorbs blood or wound secretions. It leaves no residue on the skin. I would like to show you how I have used Soft One in my practice. In a nursing or foot care practice, it's very suitable for protecting the digits or the tip of the toe. Also, in the case of an over or underlapping toe, it is useful when correcting the malposition of the toe. If I remove a callus from the tip of the toe and discover that there is an ulceration underneath the callus skin, I can use Soft One to cover and protect the area in the following way. First, cut a suitable length of 6 cm wide Soft One. Place around the toe and press edges together. Tighten by pulling slightly. Turn the material toward the area to be protected. This will put more layers on top of the wound. You can add an extra folded piece of Soft One over the tip of the toe to add cushioning to redistribute the weight. Remember, the Soft One needs to be long enough to fully cover at least one joint in order to stay in place. You can swim or take a shower with the Soft One bandage in place. When you need a bandage that will stay on well and is elastic enough for comfort, Soft One is the easiest choice. You can use Soft One to protect the nail bed after nail avulsion or in a case of an ingrown toenail or infection. Change the Soft One bandage as needed, depending if the wound is clean, infected, or secreting. You can also add a toe prop to the Soft One bandage to protect the affected toe from pressure. For example, in a case of an ingrown nail. For example, if the fifth toe is rotated and turned under the adjoining toe, cut 12 cm of 3 cm wide Soft One and place it around the fifth toe. Cut about 5 cm of 6 cm wide Soft One and turn it to make a short wedge. Attach it to the existing Soft One between 4th and 5th toes. Use the rest of the 3 cm wide Soft One and twist it around the 5th toe so that the added wedge will stay inside the dressing. If you have an over or underlapping toe, it can be brought to level with the other toes comfortably and easily by using Soft One. If you have an underlapping toe, Cut about 20 centimeters of 6 centimeter wide soft one. Fold it lengthwise into 2 or 3 parts. This way you get a firmer, more stable strip. Place the strip of folded soft one around the toe to be lifted upwards. Lift the toe so it will be in line with the others by pulling upward from both ends of the soft one. Fasten by bringing each end around the adjoining toe and press them together under the toes. You can make a special soft splint by placing a little bit of medical grade lamb's wool inside the soft one. Remember, do not pull the soft one tightly as the foot widens on weight bearing. The toes need to be able to fit in line loosely. You can fix an overlying toe using the same method, pushing the toe down and fastening the soft one on top of the toes. Change the splint as needed. It can be left in place overnight or for several days at a time, as soft one is breathable. If this feels good and helps the problem, you can later make a multi-use Van Lith silicone orthotic device using the same technique. As soft one is elastic and soft, it will feel comfortable and will not affect normal walking. If you need to make a splint for toes or fingers, you can use soft one. Place once or twice around the affected finger or toe. Then around the adjoining finger or toe, tying them together. This way, the skin between the fingers or toes stays dry and the 2 digits will not rub together. Quick Stop is a powder in a spray can that will stop bleeding. Quick Stop is a fine powder that is sprayed directly onto the bleeding wound. Plantar warts bleed often while the callus ring and the dead tissue is mechanically removed from around it. When you stop the bleeding with Quick Stop, it will make it easier for you to finish the treatment. Shake the bottle and spray onto the wound or cut from a 15 centimeter distance. Quick Stop will not sting as the alcohol from the propellant gas has time to evaporate before reaching the wound. Quick Stop covers the wound with microparticles of oxidized cellulose. These particles have a great ability to absorb blood. Quick Stop will make an elastic film over the wound. It is made of natural ingredients and is allergy tested. The active ingredient is natrium calcium salt of oxidized cellulose. If bleeding is profuse, or the cut is deep or large, or the patient is using blood-thinning medications, it may be necessary to use Quick Stop together with soft one bandage. If you cut yourself accidentally, you can quickly apply some Quick Stop and soft one bandage and continue your work. Remember to wear protective gloves. These products are safe and suitable for use on all your patients. I hope that these tips will help you. Please use your imagination to create more ways to use these products to help your patients. For more information, please contact the manufacturer.